What I'm about to show you is life-saving for the people of Gaza. I'm going to speak to a doctor who's going to go through these life-saving equipment. Tell us what this is.
We've got a few different items of equipment. So this one is a bear hugger blanket. So it's got warm air coming through and wrapping the trauma patient as they come into the operating theatre. And the key thing that this item does is keep the trauma patient warm. Trauma patients, they have poor clotting because they are cold, because they are hypothermic. And this particular blanket keeps all of the underbody of the patient warm.
Do they have these in Gaza at the moment?
So having spoken to one of the doctors that's come back from Gaza this week, the hospital that he was working at, they do not have any of these blankets at all. And it's a standard component of trauma care that we have.
So this really could save lives, many lives.
Yeah, exactly, no doubt.
And each one cost approximately how much?
Between 20 and 25 pounds.
You got something over there. Can you show us what that does and how that will help the people?
Yeah, so we've invested in two types of fluid warming devices. So whenever we give blood products to a patient, so red blood cells, plasma, or fluid, so saline, at the moment it's being given at room temperature or it's being put into the microwave when there's power that's available and then heated up for fluid. You can't do that with blood. So what we have here are a mains powered warming system where you get saline coming through. The blue side is the cold side. It comes through here. It's got a cartridge inside which warms up the fluid up to the correct temperature, and then it comes out. So that's coming out at the right temperature in order to promote clotting inside of the body.
So it's warm.
Yeah, exactly. And at the moment, they're just getting stuff which is coming out of the fridge. You know, cold, that's going to contribute to poor clotting. Whereas this is a standard of care that we have here in the UK. The other thing that we've invested in is battery-powered warmers. So if the generators aren't available, if there isn't mains power available, again, we have a battery-powered system here, which as you can see is about the size of two phones put together. And if you come around, you'll see now within a few seconds, that's turned green. And if you bring your hand out,
Yeah, it's getting warm. Yeah.
and that particular battery pack will last about 4 liters. So that's enough blood that we can use to resuscitate a patient.
Wow. And how much, again, do these equipment cost?
So the mains powered one, anywhere in the region of 300 to 500 pounds. The battery powered, again, because it's battery powered and portable, anywhere in the region of 500 to 1,000 pounds.
I just want to say that these equipment will be delivered in Gaza within days. So what we want is more people to come forward to donate these essential medical aid that will save lives.